what does stress have to do with blood pressure? Well, if you've ever experienced stress, you know that your blood pressure can go up. The more stressed you are, the higher your blood pressure will get. What do we do if we want to lower that blood pressure, and what if it goes up and stays up there? Here's how it works. You see, you have these receptors throughout your body called adrenergic receptors. They are the receptors that respond to adrenaline. You know what adrenaline is. You get an adrenaline rush. If you're about to go on a fight, if you're on a roller coaster, if you do something scary or crazy, adrenaline gets released in the body, and that hits those receptors, and that raises your blood pressure because you want to be ready for activity, either running, fighting, jumping, whatever it might be. Blood leaves your face, your hands, your feet, goes to the muscles. Digestion slows down or stops sometimes. All the energy is used towards activity. That will raise the blood pressure because you have to be ready for that. See, if you put me on a treadmill and say run, and if my blood pressure stays at, let's say, 120/70, I'll pass out because that blood pressure is not high enough to sustain the activity I'm doing. So the faster I run, the more I exert myself, the higher my blood pressure should be. Now, stress does the same thing. You're in your car, you're in rush hour traffic, someone cuts you off, your blood pressure goes up because catecholamines get released in your body under stress. Those catecholamines still activate those same adrenergic receptors which raise your blood pressure. Sometimes we need to take blood pressure medication. Blood pressure medication, the most common one is called beta blockers. They block the beta receptors, the beta adrenergic receptors that stop those catecholamines from hitting it, which has that adrenaline response. And so the problem with that is a lot of times those catecholamines continue to build up in the body. And if you stop blocking that receptor, all of it hits the receptor all at once, your blood pressure will spike. So if you're on the medication, don't go off of it. If you want to come off of it, you need to talk to a medical doctor or a pharmacist, someone who understands you and knows what you're going through, and do it with you slowly. But stress absolutely does raise our blood pressure. Usually it's a good thing. You want your blood pressure to go up, just like if I'm on a treadmill running, I want my blood pressure higher. If I get angry, if I get upset, if I'm anxious, if I'm nervous, if I'm worried, I actually want my blood pressure to be higher. That's a good thing. It sustains life. It keeps me ready to face that stressful situation. I hope that helps you. I hope it answers the question of what stress has to do with blood pressure. Please subscribe to the channel. Please share the video. There are a lot of people who have blood pressure issues. Like the video. Let's get it out there. Let's let people understand how blood pressure and stress work. Take care. We'll talk soon.